All right, everyone, settle in. Today we are tackling one of the most critical topics in neurology, the stroke masterclass. Let's get to work. In stroke care, time is brain. Our goal is the golden hour, beginning treatment within 60 minutes of hospital arrival. Nearly 2 million brain cells die every minute. The Be Fast mnemonic is our frontline defense for rapid identification. Every clinical second counts when identifying these 6 life-altering signs. B is for balance. Look for sudden dizziness or loss of coordination. E is for eyes. Assess for blurred, double, or sudden loss of vision. F is for face. Check for facial drooping or an uneven smile. A is for arm. Watch for drift or weakness when both arms are raised. S is for speech. Listen for slurring or difficulty finding words. T is for time. Record the last known well time immediately. Once identified, we quantify severity using the NIH stroke scale. This 15-item tool tracks neurological deficits with clinical precision. We start with level of consciousness and orientation. Can they follow commands? Do they know where they are? Next, we assess best gaze and visual fields. We're checking for any loss of side vision or abnormal eye movement. Motor strength is tested in each extremity. We also check for limb ataxia, that loss of coordination that can indicate cerebellar involvement. Scores range from 0 to 42. A score of 5 to 15 is often the intervention window. Report any increase of 2 or more points immediately. The diagnostic priority is a stat non-contrast head CT. This is the only way to rule out hemorrhage before considering thrombolytics. Ischemic strokes are blockages, accounting for 87% of cases. Hemorrhagic strokes are ruptures, where clot busters are absolutely forbidden. Immediate nursing actions. Maintain oxygen above 94%. Keep the head of the bed at 30 degrees and check blood glucose immediately to rule out mimics. The patient must remain NPO, nothing by mouth, until a formal swallow screen is completed. We must prevent aspiration pneumonia. Pharmacology. Alteplase, or TPA, is our gold standard thrombolytic. It dissolves the fibrin in the clot to restore vital cerebral blood flow. Dosing is 0.9 milligrams per kilogram. Give 10% as an IV bolus over 1 minute, then the rest over 1 hour. The window is narrow. TPA must be started within 3 to 4.5 hours of the last known well time. Time is brain cells. Blood pressure is a major safety threshold. It must be below 185 over 110 before starting and maintained below 180 over 105 for 24 hours after. Absolute contraindications include active internal bleeding, intracranial neoplasm, or major surgery within the last 14 days to 3 months. Post-TPA, monitor neurostatus and blood pressure every 15 minutes for 2 hours. Your vigilance is the patient's safety net. Watch closely for angioedema, sudden swelling of the tongue or lips. This is an airway emergency. Stop the TPA immediately. If you see signs of intracranial hemorrhage, like sudden severe headache, nausea, or decreased consciousness, stop the infusion and notify the provider. Check for systemic bleeding, oozing at puncture sites, bleeding gums, or hematuria. TPA thins the whole system, not just the brain clot. Crucially, for the first 24 hours after TPA, there are no invasive procedures allowed. No IM injections, Foley catheters, or NGTs. Secondary prevention starts once stable. This means initiating antiplatelet therapy and managing underlying risks like hypertension and diabetes. Left-sided strokes affect the right body. They often cause aphasia, altered intellect, and slow, cautious behavior. Right-sided strokes affect the left body. These patients often have spatial deficits, impulsive behavior, and a high risk for injury. For unilateral neglect, prioritize safety. Remind patients to check their affected side and keep essential items within their field of vision. When communicating with aphasic patients, use simple yes or no questions and allow plenty of time for processing. Rehabilitation begins on day 1. Early mobilization and consistent physical therapy are key to restoring function and independence. Stroke care is a high-stakes race. With speed and clinical judgment, you can save a life. Keep learning and stay vigilant. If this masterclass helped you, please like, share, and subscribe for more nursing education. I'm Nurse Dante. Go study, get some rest, and I'll see you in clinicals.